IVF essentially is fertilizing an egg outside of the body. So IVF conventionally is getting a petri dish and putting an egg with some sperm in that petri dish, and then the sperm will swim to the egg and penetrate the egg, much like it would in the fallopian tubes. And then when that is fertilized, the embryo or the blastocyst is then put back into the woman's body, and hopefully she then gets pregnant. There is another form of IVF called ICSI, where the sperm is actually effectively injected into the egg itself rather than waiting for it to penetrate the egg. And that's done usually with people who have a few more issues with fertility. In a standard long protocol, what happens is, first of all, you're given some pituitary downregulation drugs. And what those do is switch off your natural ovulation so that the clinicians can control what's going on in your body. And then you're given some stimulation drugs. And what happens there is basically what they're doing is they're encouraging your endometrium to thicken, and they're encouraging your follicles on your ovaries to grow. And you'll be given some scans in that time to check that your endometrium is thick enough and that the follicles are big enough. And then when they are, you're going to be given what's called an HCG trigger shot. And that matures your follicles so that they can retrieve your eggs. After about 36 hours after your trigger shot, you will have your egg collection or harvesting, whatever they want to call it, at your clinic, where you will go in and you'll be sedated. And they will actually physically retrieve the eggs from your ovaries. And when that happens, they will tell you how many they retrieved, and they will have a look at them and how mature and how good they think they are. And that's when they will do the IVF or the ICSI. And they will basically fertilize those eggs for you outside of your body. And then you have a little bit of a waiting time while they develop mature your embryos. And what usually happens is that they will choose one or two that they think are the best ones to put back into your body. The NHS like to do one, some clinics do two, and they'll be your strongest embryos. And you will have that embryo basically put through your cervix back into your uterus, where hopefully it will be able to implant into your womb lining. And unfortunately, then we have to wait for 2 whole weeks before we do a pregnancy test to find out if it worked. For anybody who is looking to do IVF, I would recommend that you give yourself at least 3 months as a minimum to prepare for yourself and for your partner or your husband or whoever's donating the sperm, to make sure that your eggs and sperm are at top quality. So in that time, use that to really review your lifestyle and your diet choices. Maybe it's a case that you need to think about how much stress you're under, how much sleep you're having, and make some tweaks there. Maybe it's a case that you do over exercise and that you need to reduce that. Maybe it's that you need to look at your diet. So I would definitely recommend that if you are trying for a baby, no matter what your pathway, that you cut out all processed foods and trans fats, and make sure that you eat plenty of fruit, vegetables, nuts and seeds, and omega-3 oils. I'd also say that everyone should be looking at really good high quality fertility supplementation. And that isn't a case of just going and buying the cheapest product out there, but really making sure you've got the best product that you can have for your personal circumstances on your journey. And again, it's a case of both of you doing this, not just the woman. This is a 2-person journey.